My name is Paul Hanna. I am a product of GlomCon, class of 2023.
It's a pleasure to be on this platform. My background is that I'm a transplant nephrologist, currently working as an assistant professor in nephrology and transplant at University of Massachusetts Chan Medical School.
My name is Arvind Singh. I'm a renal or nephrology consultant. I'm based in Gloucestershire, United Kingdom, and working as a consultant here, at the same time being the clinical lead for glomerular nephritis.
My name is Joana Gameiro. I'm a nephrologist from Portugal. I joined the GlomCon Fellowship and I was so inspired by the community.
Nothing short of transformative. The reason I say that is because during my time on GlomCon, there was a lot of professional enrichment. There was a lot of networking, and there's a lot of education and activities that helped me shape my career to the way it is right now.
The experience was really transforming and it's fairly enriching. The GlomCon Fellowship, it combines, clinical-based discussions, but also updates, theory and lecture.
It was an experience full of immense learning, and I cannot even tell you how drastically it helps to transform practice patterns and approach to glomerular diseases after having gone through this training.
To be honest, I had an amazing, extremely enriching experience with GlomCon, and it was sort of more refining myself, both intellectually and at a professional level.
It inspired me to start this clinic with other nephrologists from my department. So we do this specialized clinic. We just observe and, of course, discuss amongst ourselves these more complex cases.
We were able to set up the GN clinic. We were able to strategize how to, incorporate the different strategies for management of the GN related problems, not only the medicinal aspect, but also the socio-psychological aspect of patient care, which I learned through the GlomCon Fellowship.
One word to it, it's the confidence. As a clinician, you really want to be confident. Even before going to see the patient in the clinic, you need to know what you're going to deal with.
The most valuable aspect of the fellowship is the personalization during the training that we receive from the experts. It's like as they're addressing the group at the same time, but even while addressing the whole group, they are also addressing each and everyone's problems like on a one-to-one basis.
The most valuable aspects would be the access to world-renowned physicians, as well as networking for collaborative work.
You can get updates, and it's very easy and engaging way to learn. And of course, you get to ask your questions to experts. Of course, it is a way to systematically engage with people all over the world.
So fellowship basically introduced me to a new way of thinking, and that is there's no I in medicine, there's only we in medicine, and we all collaborate and discover things together.
The mindset with which I entered in this fellowship with my passion for glomerular diseases is I wanted to establish a GN clinic at our institute. And even before the fellowship has ended, with the great guidance that I received from the faculty, from the experts, we have been able to establish this at our institute. And we are really able to make difference to the life of patients with the understanding of the glomerular diseases that I learned through the fellowship and the management strategies that I learned. So I'm really, immensely grateful for this, and this has been amazing.
You get to still engage with these people that you've met, and of course, not only you continue to, after you've done the fellowship, but now you know that you have other workshops that can help you grow as a nephrologist. And of course, you still have the weekly sessions that you can actually still see some dates that we've had even before the fellowship was available.
Indeed it is, and I think I would strongly recommend people, especially if they're nephrology fellows or their early career into nephrology, or even with academic interest, to see if GlomCon is an option for them.
I would absolutely 100% recommend it to both my colleagues as well as my trainees. You know, as one of the directors said at the beginning of my GlomCon year, GlomCon is what you make it to be.
I have already recommended it to many of my colleagues. I have felt really, you know, immensely academically rich after the fellowship, and this is what I would advise to all my peers as well. The reason being because as nephrologists, as physicians, the more enhancement we achieve in our academic knowledge, the better outcomes we can have for our patients, the better we can contribute to our community.
I would absolutely recommend. And we also always promote the fellowship through GlomCon Portugal as well. You know, this is a unique opportunity. It's so valuable. Even if you don't want to focus, but when you're a fellow, I mean, it's always important to know these rare kidney disease and to have some knowledge, even if you don't specialize or if you don't want to focus. But it's always good to, you know, learn from the experts, and GlomCon, the fellowship, really gives you access to that.